I pledge allegiance to the flag of the United States of America, the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Trying to maintain some sense of normalcy here, folks. Appreciate that. All right, quickly before we do public audience, I just want to have a roll call so that the folks at home and the folks on the call know who's here. So Melissa Appleby, are you with us?
I'm here.
Good morning.
Morning.
All right, I'm here, Sean Ascom. Chief Baldus.
I am here, thanks.
Morning, Chief. Mike Berry.
Good morning, I'm here.
Morning, Mike. Chief Bolter.
Yes, good morning, I'm here, thank you.
Morning, Chief. Maria, good morning.
Good morning.
Kristen Formanak.
Good morning. Just hopping out. Oh, there she is.
Oh, good morning, Kristen. Jennifer Katanis.
I'm here.
Good morning, my friend.
Good morning.
Kevin Kowalski.
Kevin was out on a call, so he may not be available yet.
Jeez, all right, that's 2 weeks in a row, poor guy. All right, hope everybody's okay. Mark Kritz.
Here.
Morning, Mark. Mike Long. Melissa Marquis. Mark Massaro. Sarah Nielsen.
Present by phone.
Good morning, Sarah.
Good morning.
Chris Peterson.
Good morning, folks. Present.
Morning, Chris. Tom Roy with his patriotic mask there. Morning, Tom. Nancy Sheets. I saw Karen Stewart earlier.
Yep, I'm here.
Karen. Neil Sullivan.
Yeah, good morning. Also present by phone.
Morning, Neil. And then Gary Wilcox, I believe your iPad is connected. Are you there as well, my friend?
I am.
Good morning. Thank you. And then again, Karen Haberlin, thank you so much for sticking with us during all of this and signing up for extra duty. We appreciate that. Are there any more folks that I have not called that are present? All right, with that, Maria, do we have any public audience? I have not received any more folks that I have not called. Mark, if you could just go on mute, Mark Ornstein.
No, I'm just here to record.
Okay. All right, folks, we have the April 9th minutes that were included in the package. Are there any changes, updates, edits to that? Karen, thank you again very much for putting that all together. All right, hearing none, those minutes will stand. All right, Jennifer Katanis, the star of the hour again.
I don't like being the star of this. Anyway, hello, everyone. As of yesterday, the Farmington Valley had 162 lab confirmed cases, and sadly, we report 14 deaths in the Farmington Valley. As many of you know, we continue to do contact tracing for all of our lab confirmed cases, which involves a phone call to the case if they're not hospitalized or not in a long-term care or assisted living facility. We track their contacts and provide guidance on isolation of the ill and quarantining of close contacts. In general, that is, at this point, family members. I wanted to report that today, and I did give our town CEOs a heads up, the state health department will be including detailed information regarding the status of our long-term care facilities by facility name. We have been talking practically every other day with our long-term care and assisted living facilities. We are experiencing increases in cases and sadly some deaths in our long-term care facilities. So we can, one, expect that that report will come out from the state today and every Thursday from this point forward. And that may result in inquiries to town officials and to the local health department. I have to get off the phone after my report or after any questions for me. We yesterday, as part of the Capital Region, did receive very modest supply of personal protective equipment yesterday out of West Hartford, there was a distribution to long-term care and assisted living facilities. We, as local health departments in the capital region, also received some supplies to distribute to priority groups, including dialysis centers, urgent care centers, and home health. Unfortunately, as we expected, the supplies to us equate to about a pallet of things. We have prioritized the largest dialysis centers in our area, the largest home health, and the largest urgent care. And we'll be making calls later today, and by invitation, they will be able to come and pick up some supplies from us. This is being supported by the emergency managers in the Farmington Valley. This is going to continue over every week. And so I know Kevin Kowalski's been aware of this. The distribution point is in Avon. Last thing that I will mention, and then I'll entertain questions. You may have heard that the governor is likely to issue another governor's declaration around the use of masks while the general public is out and about doing grocery shopping, et cetera. The Farmington Valley issued that recommendation a week ago. We did push out correspondence to our towns, and we'll do that again. And I think my observation certainly is that we are seeing far more individuals in grocery stores wearing masks, so we just need to continue to support that. One last thing from a data perspective, we are now going to start looking at the trends by date of specimen collection, so that we maybe can get a better handle on where the Farmington Valley is relative to the peak versus leveling off versus decline. The challenge with this is obviously the testing is a significant limitation, and it is not a true reflection of the number of cases that we have in our community. Hospitalization would be a better indicator of this. However, we don't have good data at the district level on hospitalizations for our residents. We only have data based on the location of the hospital, and you can see that at the state level. But we're going to be spending some time trying to look at that data just to see if we can, provide any intel on where the Farmington Valley is. I do not think that we have reached the peak in the Farmington Valley. I think we're probably another week out at least, based on what I'm seeing with the new cases coming in. But again, we're trying the best we can to use the limited data that we have to provide us that information or some information with regard to that. Our complaints regarding open establishments and lack of social distancing or lack of PPE have certainly declined. So I hope that that is an indication that, people are getting used to what needs to happen when they're waiting in line at a grocery store, et cetera. So that's a good thing. And with that, I think I will just stop and entertain any questions people have.
Jennifer, thank you. This is Sean. Let me just start that off. So what's the advice for folks like myself and others that don't have access to a mask?
Good question. I think there's a lot of resources online that can provide people with very simple and easy to use homemade masks. We are encouraging the general public to use these types of face coverings as opposed to surgical or, other types of masks, because we really need to preserve those for our healthcare workers and first responders.
Okay, and I appreciate that. Yeah, this is not a call to go get on Amazon and try to track down N95s as an individual. It's to use the scarf for what Maria or Tom displayed previously. Correct?
Yeah, absolutely. And thanks for that clarification, Sean.
Yeah, because it's again, what I'm trying to avoid here is there's a lot of confusion and fear, and folks, we've gotten discussions of folks accosting each other in grocery stores or online about who wears a mask and who doesn't, and we're not asking the public to police it at this point. We're just asking folks to do the best, wear some sort of homemade mask or otherwise, and do your best to protect yourself, right?
Right.
Thank you. Appreciate that. Other questions from the group? No? All right, Jennifer, we appreciate all your work. Please try to get some sleep through all this. But,
Thank you, and thanks for all of your support. Yeah, we'll get through this one way or the other.
well, we appreciate that. We appreciate your efforts on the front line. Thank you very much.
Yep, take care. Bye.
All right. Bye-bye. All right, for the folks at home, that was Jennifer Katanis from the Farmington Valley Health District, and she's our direct source to what's going on at the state level. And as you heard, despite what we hear on the news or otherwise, her prediction as the expert on the topic, that we have not yet hit the peak in the Farmington Valley. So for those folks at home, you're hearing a lot of different things on Fox or CNN or from the governor or otherwise. Our local expert, Jennifer Katanis from the Health District, advises that we haven't yet seen it, so we need to continue to be diligent. All right, with that, Maria, Town Manager's Office, how are we doing on the town side?
Good, thank you. So our town buildings continue to remain closed at this time, and most of our administrative staff at this point is working remotely. We do have what I would characterize sort of as a skeleton crew coming into our buildings on a daily basis to take care of tasks that really only can be performed by being present in the building. And once those tasks are performed, generally folks are leaving and then going home and finishing their shift and working remotely. We're also redeploying resources where we can to help support the virus response at this point in time. I think a neat example of this is that with the public library being closed, our innovators space, the maker space, wasn't being used. And so we are now using our 3D printer, and library staff is making N95 masks with the 3D printer. UConn Health just picked up the first batch last week. So I think that's a really neat example of all our buildings are close to the public, trying to get really creative and think about what resources do we have that we could help use to support the response efforts. And so I just think that's a great example of the creative work that our team is doing here. Our public works crews still are working, and when we get to that point, I'll let Tom cover that more. Our parks and golf crews are also still working. They've modified their work practices to ensure safe practices and social distancing while they're working. They have also broken up to which facilities they're reporting to minimize the number of people reporting to any one location. And I'll also let the chief speak to staffing when he gets to this part of the agenda. We have a number of facility closures still. The transfer station is now closed. That will be closed until further notice. If we do have folks who have an urgent need or concern about disposal of items, they can contact the Public Works Department. If it's something that's more routine, such as they need curbside bulky waste pickup, they need an extra recycling bin, they need a dumpster, in those circumstances, they should contact their waste hauler, whether it's all waste or paints, and that they'll be able to accommodate individuals with those more routine needs. Our playgrounds, our skate park, our basketball courts, tennis courts, and paddle tennis courts do remain closed to the public. Our parks and open space do remain open for passive recreation at this time. Our April household hazardous waste collection has been canceled. And then recently the governor updated the date that public meetings will remain closed to the public. Originally that was slated for April 22nd. We'll now be operating in this mode of essentially virtual meetings through May 20th. So we'll be doing this for quite a bit longer. We have a number of opportunities still for residents to stay informed, and just want to remind folks of how they can do that. We have a news and announcements email subscription service. People can sign up for that by going to our website. We're maintaining our town website regularly with important information or changes to programs and services. We have Facebook and Twitter accounts and encourage folks to follow those accounts. Every other week, we've been doing an SCTV public service announcement. We actually have another one scheduled to record after this meeting this morning. I think those have been very informative, and again, would encourage people to watch those. And then lastly, we have a recent governor's executive order with the tax deferral and low interest rate programs. I know we briefly spoke about those last week at the meeting. Our revenue collector's office has been working with IT, and we now have information available, including the application for folks, available on the tax collector's webpage. So we'll start accepting applications as of May 1st. And again, just would encourage people to do as much as possible online with the application and submitting their materials. And that's it for this morning.
Maria, I appreciate that and appreciate all the efforts from you and the town staff on keeping business running. I know it's not the easiest thing in the world for both you and the residents, but appreciate the efforts.
You're welcome.
Folks, any questions for Maria on the town side? Obviously, we'll get to individual departments in a little bit here. All right, Mike and Kevin, if you're on, the emergency management, please.
Go ahead, Mike.
All right. Good morning, everybody. Yesterday, we participated in a regional pod or distribution point in West Hartford, as Jennifer stated. I was the operations section chief working with the incident management team for Region 3. So I wanted to be on site to see what was going on and how we were doing. We worked directly with the Department of Health and the National Guard at the distribution point. We did try to get as many items together as possible, but with only one tractor trailer pulling up and unloading, we really had very few supplies to distribute to to a lot of places that needed it. So we still are looking for PPE. We are still scrambling, trying to find it anywhere we can. And we tried to give out what we could to our facilities. As the local facilities came in, I was able to speak to some of the representatives of the Simsbury facilities to get their idea of what they were going through and how they were doing. We do have one facility that did request assistance through the region this week. We were able to help them get some assistance through the Medical Reserve Corps, and hopefully that situation is going to be relieving itself. The other facilities are reporting in that they're doing well. However, we're, again, still in the holding pattern, and we know that the numbers of patients will continue to go up, and we're hoping that it stays out of our long-term care facilities. We are encouraging patience with people. We know that the tensions are high. We know that stores are cooperating by putting spacing as you're at the registers, or you can only go up and down one line in different stores. So we are asking the public to be patient and to work with stores and not lose your cool in stores and start screaming or yelling. We're not asking, again, as Jennifer said, we're not asking them to police the situation. Just kind of be kind to your neighbor and then continue to try to work to get through this. And again, we are continuing to keep track of regional things through WebEOC. We are updating it daily. And through WSIM, we continue to pump out messages. I'm looking for the new updated list, and I'll be talking to Melissa later about getting the new updated lists of the restaurants, stores, and facilities that are open for the public to be able to work with. And we'll also update the messages that the governor is putting out about what to wear for a mask. Again, we're asking them to stay away from the surgical and the N95s, save those for the long-term care facilities, the home health cares, and the first responders, and give them ideas of what they can wear, such as scarves and things like that when they're out. So, and with that, I'll turn it over to Kevin.
Thanks, Mike. That was a good report. On just a few more things to add to it. Again, our primary mission right now is to get in the PPE as much as we can through commercial sources as well as the state and federal. As Mike alluded to, the state and federal reserves are only going initially to the mass care facilities and the physicians in the community. So we're still on our own for any of the needs or wants that the first responders have. So we are getting some in through a contractor, through secondary channels that we're purchasing. And hopefully those will be in this week for N95s, or actually P95s, which is a little bit different protection, but it'll still meet the standards of the N95. We did some fit testing for a facility in the community for their folks to wear initially based on their amount of people that have the virus. So we wanted to make sure that they were protected. So we initiated that through the fire department. There'll be a conference call today with FEMA in reference to getting reimbursement for all our requirements or all the things that are happening here with the emergency. Predominantly, I believe it's for the fire department and EMS and police will be equipment, as the FEMA reimbursement is typically for above and beyond costs, such as overtime that you have to put on and things like that. Again, we had a request for the Medical Reserve Corps through the region. That was exercised, and we are working with that facility to make sure that their needs are met as close as possible. Of course, Medical Reserve Corps provides nursing and nursing assistance. So that is a very big commodity right now and very much sought after. So we're very happy to be able to get a couple, at least through the Medical Reserve Corps to date. We're also working, and we're asking here that if any of the town divisions need masks, we have an additional 500 non-medical masks due in here this week, and we'll be more than happy to get them out to you if you need them. We just dropped off, I think, 100 of them to the highway department, so they should be in good shape for the time being. So if anyone needs them, please contact me and we'll get them up. Kristen gave me the list and the inventory of what they have and what they have in production. It's great to hear a lot of the folks in the community are sewing together and bringing them out to the town through social services and through their needs, taking care of it. So that's pretty much what we have right now. Any questions? More than happy to answer them.
Thank you both, Mike and Kevin. Appreciate your efforts there. Folks, questions for these guys? And Kevin, I echo your comments. The residents have been outstanding, helping with supporting those non-surgical masks. So that's been great.
Yeah, the needs are going to be going up, obviously, over the next several weeks. So certainly, we're going to try to answer those needs somehow, and we're getting some stock in. So that'll be excellent.
And Mike, I appreciate you bringing up the point of we've all got to take a deep breath and be patient with each other. Folks on this call, folks in the community, folks everywhere are obviously all dealing with this. We're all in this together, and it stresses us and hits us and impacts us a little bit differently. So the more kindness we can show to each other, hopefully the easier we'll all get through this. So appreciate that reminder, Mike. All right, Chief, police.
Good morning, everybody. Much shorter report here. Our staffing levels remain fairly consistent and adequate. We have taken many precautions to preserve our staffing levels, the integrity of the services that we need to provide, as well as the personal protective equipment that we have. So that has gone very well so far. We have received some more PPE from the state, and like Jennifer had said earlier, very moderate or a small quantity of that, but that is being sent to us. Our last delivery was, I think, 4 or 5 boxes of gloves and then a few masks as well. Our calls for service are remaining relatively low, so we had a slight increase last week, and it's sort of leveled off and decreased a little bit, which is very good for us. We are updating our staffing levels through the web EOC almost on a daily basis, and we're not receiving many phone calls about any potential violations of the social distancing guidelines. We have received a few here and there, and we've taken the opportunities to try to educate and correct that, but they've been very, very few and far. So I think we're seeing the continued compliance with the recommendations and the guidance, and we are hoping to encourage that to continue.
Thank you, Chief. Appreciate that, and appreciate keeping the community safe for all the other things that happen in life that are still going on.
They are, yes. Thank you.
All right, any questions for our chief? All right. Karen, ambulance. How's the
Yes,
team
good
doing?
morning. How is everybody today?
All hanging in there.
Hanging in there. I'm going to try to get through this without my dog barking, so I apologize if she has something to input here.
That's okay. It's a new work from home environment. We all understand.
It is. So I did go yesterday to pick up our rations from the state. Was not as much as I had hoped for as well. We certainly are going through equipment very, very quickly, and running short on gallons is now my priority to try to find. We seem to be okay for masks right now and for face shields and gloves, but gallons seem to be now the new hot commodity for me to find. But trying to order from every source that I can find. So Kevin, if you have any leads, I would appreciate on anything you found for that. Call volume has been pretty steady for us. I would say probably 100% of our calls are COVID related at this point. So which means our crews all have to gown up with PPE material. Everyone that has been exposed, fortunately, is not showing any signs or symptoms, which is good. So everybody's staying healthy, which is a positive thing. So I have no staffing issues at this point. We did have one of what could have been my worst nightmare yesterday, which was a cluster of calls coming out of McLean simultaneously, which I know put a stress on dispatch. Yesterday, I'm not quite sure why they did what they did. It was totally unnecessary. All the 4 patients that they called 911 for were perfectly stable, and it could have been handled much differently. So I'm reaching out to McLean to see if there's a better way to handle that type of situation in case that should happen again. Basically, they stripped the valley of every single ambulance between us, Canton, and Granby, which was a little disconcerting at the time, and something that we was handled as diplomatically as possible with McLean. But I think there needs to be a discussion with the staff there on what's the most appropriate way to handle the need for transporting patients out of McLean or any nursing home to the hospital that's not on a priority basis. So that's something I'm going to try to address today, and hopefully dispatch won't have to go through that again, because they literally called 911 4 individual times, which, if you can imagine, the dispatcher was certainly overwhelmed, and that was not necessary. So other than that, like I said, everybody's staying healthy, and we're just still looking for equipment, and we're just going to keep plugging along. I do have some cloth masks if somebody is looking for a few that we can certainly turn back to the public, that really we're using masks that actually cover N95s. These were made just to be a mock-up of a surgical mask that we really can't use. So I'm happy to share those back with the public. If anybody needs those, they can always let me know. And that's what I have for today. Any questions?
Yeah, Karen, if I may ask, or actually tell you, I'm in contact with McLean probably about 3 or 4 times a day, and we have a good rapport going right now. If you're interested, I can help you with your situation. So just get in touch with me, and we can chat about it.
Yeah, absolutely. I just think it just had to be, I think it just was an escalated situation that probably won't happen again, but I think we need to maybe educate McLean or the staff on what they're actually doing, because I think they think that there's 30 or 50 ambulances just sitting out here waiting for them at their beck and call, which is just, again, I understand it's stressful for their end, but it caused a huge amount of stress on the outside as well, which it didn't need to happen, because there was not one critical patient involved in those calls. So, but yeah, we definitely can talk about it. I appreciate it.
You're correct. It's just that they should be working under an incident command system in which everything should be funneled through one person, so you
Absolutely.
don't have 4 or 5 different people in different divisions calling for 911.
Absolutely.
So I'm more than happy to help you with it.
Okay.
Yeah,
Awesome. Thank you.
suggest, Karen, let's take this conversation offline with dispatch and with Kevin and everyone else, and make sure that your concerns are addressed appropriately.
Makes sense. Thank you. I appreciate it.
But from a public safety standpoint, there was no compromise in the public safety system. The dispatch was still operating within norms yesterday.
Yes, yeah, it was a brief period of quite a bit of traffic and quite a bit of work, but you're correct. It was operating normally.
And we have redundancies in place, correct, within the department for those heavy volumes that other officers can come in and assist with dispatch, et cetera, if needed due to volume?
Yes, that is possible. Yep.
So just want to make sure the public understands that while this was an issue for McLean and for the ambulance, the community was not at risk, and the system was still functioning as needed. So.
And Sean, I do apologize. I didn't mean to give that impression. I was just.
No, it's okay.
I just want to make sure people understood what happened was just an isolated incident, and we're going to deal with it so that it doesn't happen again. And everything was handled appropriately, and everybody was transported and all was taken care of.
Absolutely. And I get it. These are stressful, unique situations, and they need to be addressed. So appreciate that. Appreciate you bringing it up, Karen.
Sure.
All right, folks, anything else for ambulance? All right, Chief Baldus, fire.
Hi, excuse me, good morning. And right now, as far as our COVID-19 response, we're continuing on a status quo basis. We're very fortunate to report that we have no illnesses among any of our members or families, contrary to what you may see on public media or on social media. The chief has not been tested and the chief does not have COVID-19. We continue to follow our distancing guidelines and still, as you've heard from others, still working on getting PPE. We did respond, as I think most of you may know, to a significant structure fire on Easter morning this past Sunday. We had a complete loss of a 2-car garage, 2 automobiles with damage to a 3rd auto, and also damage to the house that unfortunately made the house uninhabitable. We were very fortunate the occupants got out safely. There was no injuries that were reported among the firefighting staff, and the fire marshal's office did determine that this fire was started to fire pit ashes that were disposed in a plastic trash receptacle, and which obviously makes it very, very important for us to continue to remind the public about the importance of proper ash disposal. This is a very big concern, and you need to make sure that the ashes are put in a metal container for a number of days, as the ashes can continue to hold their heat for a number of days. And before you actually dispose of them in your trash receptacle, you should actually make sure they're cold to touch. So you certainly want to be careful there. We don't want to have any of those kind of activities again. We have seen an uptick or an increase in our open burning activity. And again, remind the residents that open burning isn't permitted. We do know that there's a number of people who are interested in having campfires in their backyards, especially now with families having to be home. And those residents who wish to do so can find out information and also a permit form that we have that is on our website at simsburyfire.org. So there is information. We have that now on the homepage, so people can access that information as well. We want to make sure that things are done safely. There are rules and regulations that are involved, especially with this time of year with the spring. We go from a very wet period to a very dry period very quickly, and fire dangers can change, and that information is readily available. So we want to make sure our residents are staying safe in that regard. And that's my report.
Good reminders, and very happy to hear that everybody was safe from that fire on Easter morning there.
Absolutely.
All right. Any questions for Chief? Board of Education, Neil.
Yeah, good morning, everybody. Brief report for us today as we are on our April break as had been scheduled. As you probably know by the governor's order, schools are now officially closed until May 20th. So obviously, though, given the direction this is going, we are at least starting to make plans for this to be through the end of the school year, because May 20th really takes us just 3.5 weeks away from our scheduled close for the school year anyway. So our distance learning program will be back up on Monday, April 20th, next Monday. So families should certainly be aware of that as our April break ends. And in order to make our distance learning program most effective, we have had a number of teachers who have requested brief access to our buildings to gather materials that they need. So we will have an organized effort next Wednesday, April 22nd, where for staff only, there are going to be 2 windows of time from 9 to 11 in the morning, and then 1 to 3 in the afternoon, where staff will be able to access the building get what they need and get back out of the building. We're asking them to limit their visit to 20 minutes to exercise social distancing, and this is something we did last month as we went into shutdown mode, but we feel it's necessary to allow people to do that one more time. Other than that, I can report that we did operate the grab-and-go meals, even though it was April break. Volume was a little bit down on Monday of this week, but back to where we've been experiencing yesterday. So a little bit of a dip, but right back to what we've had regularly for Wednesday. So with that, I think I'll stop and see if anybody has questions.
Yeah, I appreciate that. Obviously, a lot going on the school side. Appreciate you keeping all our little ones with something to do during the day while we all try to live life and work. Any questions for Neil? All right. Kristen, Social Services.
Good morning.
Morning.
I have a brief report as well. As it's already been shared, we continue to collect the cloth homemade masks. We're continuing to try to access supplies, and weekly we distribute supplies back out to our sewers, and then they are returning masks to us. Last week was the first week that we received masks back, and I'm really thrilled to report that we received over 200 masks back. Those have all been laundered and packed into individual bags, and we are now available to make those available to the community members that would like to request them. We are available to do a curbside pickup for those masks. We're still giving priority to any staff member that still would like a mask, as well as we are getting them out to our seniors. We're continuing on Wednesdays with our lunch via curbside pickup for our seniors. And yesterday we did make the masks available to them during that lunch pickup period. Last week we did another large distribution to our vulnerable families that are experiencing food insecurity. We distributed food and toilet paper and gift cards, and we also were able to secure gift cards to Necker's Toy Store, which is available via curbside pickup, and we distributed those to the children in our families as a treat. That went really well. We're still encouraging donations to our office of food, toiletries, gift cards, and monetary donations, which can either be dropped off or mailed to us at our building. Those donations are helping us to be able to organize to possibly do a third distribution, possibly next week or the week after. And staff continues to report intermittently to the building as well as working from home. We are still responding to all of our voicemail messages and our emails. Slight uptick in people asking for help with their expenses. But I think that, the stimulus check and some of the leniencies that have been put in place are helping our folks. Our website, we're keeping our resource list updated of all the types of questions and resources that people might be needing at this time. So I encourage people to visit that resource list on our website. Our staff is still healthy. We're still going strong. And I'm available for any questions.
Kristen, thank you. Appreciate the efforts there. Questions for Social Services? All right, Mr. Roy, I intentionally didn't skip you. The line 8 was covered on my agenda, so we'll go back to Public Works. I apologize for my oversight, sir.
No, that's okay. I like coming in after Kristen. It is nice to hear some of the events that they've been doing down at Eno, and we've been happy to kind of help out where we can. And I was able to see how much some of the people enjoyed some of the support that they were receiving from Social Services. Similar to the rest of the town staff, we're protecting our staffing levels. We are wearing masks at all times when we're in and around the buildings. We're continuing to disinfect the buildings multiple times a day. Again, trying to make sure that we protect our own staffing levels so that we can respond to the community needs. We're actively discussing how and if we are going to be able to do some level of reopening of the landfill, possibly just for recycling. So that's an active discussion. I know that was a little bit of a blow to the community when we had to shut it down, but we are working very closely with the operator Paynes in finding a way to get that back open as soon as we can do so safely. And I think on our end, probably about the only thing that's not COVID related, I think the town in general, we survived a pretty significant windstorm on Monday, and I think we worked very well and closely while keeping our distance with both the police and fire and Eversource. That was quite a day. And then just Kevin Kowalski, if you think it would be beneficial, I'd be happy to join you for that FEMA call if you think it would add any value. And that's it.
Okay, Tom. We'll talk offline. Okay.
Sounds great.
Yeah, and not to be overlooked, but Tom, good point on the events of earlier this week. Obviously, there's some pretty substantial tree issues in several parts of town, including down here on Bushy Hill. So appreciate everybody getting that cleared up quickly. Unfortunately, we've had lots of practice over the years in that aspect of our emergency management side, so it doesn't even seem like an event anymore. All righty. VNA. Nancy.
Good morning.
Hey, good morning, Nancy.
I guess like everybody, we do have some PPE. It pains me to hear words like ration because I feel like this is like a time warp and we're back to like 100 years ago. We have some stuff. We obviously are going to use up our stuff depending on our census. We have some patients we are now taking care of in the community that are step-down COVID positive patients from Yukon. But so far my staff has everything they need, and I'm really happy to report that my staff remain healthy.
Excellent. Appreciate that. Any questions for Nancy? All right. Sarah, patient as always. How is the business community, my friend?
So the business community is hanging on, and, just want to encourage those that can still continue to support them financially to please do so that we have them open when this is all over. Just a reminder for the public, if you're looking for masks and you don't fit in that, Kristen's need of seniors and some of those populations first, that we have a Simsbury business, Merrill's Tailoring, in the Simsbury Town Shops, and she is making masks. They're $10 a piece. Her number is 860-217-1924 because we have tons of people looking. And the $10 helps her donate hundreds of masks to all of the healthcare professionals. She does that, she donates several hundred already. We are, as Main Street, continuing to get non-medical face masks out for our workers, especially our essential businesses and their staff. So we're working on that. And thanks again to Tom Roy and to Kevin Kowalski for their help with that. We are continuing to update the business list. We have, again, the most current list of restaurants that are open, closed, or modified, as well as non-restaurant businesses that are open, modified, open, or closed. So you can visit that list on shopsimsbury.com. We also post it continuously throughout our Facebook pages. And then just a quick thing, there was no hazardous waste disposal, as someone mentioned earlier. I do want to mention, and I hate to promote another Avon store, but it's okay because he's a Simsbury owner. Simsbury Paint's owner, which also owns the Avon Maher's Paint store, was still doing 5-gallon per home per week collection of paint. But it's only during business hours to control the collection of products. And I'd advise people to call ahead to make sure that they're still doing it and can still accept it at this time. But he was still doing it throughout this episode. So just, if people want to drop off supplies, their old paint to recycle.
Appreciate that, Sarah. How are our local business owners holding up? I know for those that are either A, not open, or B, open, it's equally stressful in different ways. Folks doing okay?
Again, the longer this goes on, Sean, the more precarious the situation is for most. We just put up some new information about unemployment, which has been a hot topic for everybody, including a lot of my either sole proprietors and/or people that have had to furlough or lay off staff. Again, where you can, please support the community where you're able to. And just the one other thing I'll urge the public to do is please be respectful of privacy. We are denying a ton of requests from people asking, who's tested positive and lots of rumors and things like that. And it's not helpful to anyone. Please be respectful of people's privacy and especially their medical privacy. And please be careful about what you're posting or trying to post on Facebook.
Yeah, I would agree. Those are potential HIPAA violations, and folks should really be aware of that. We have an obligation as public officials and everyone. We don't disclose health information ever as a practice, and folks should practice the same thing at home. We should also remember that a lot of our businesses, they're owned by local residents in our valley and our state. They're just as affected by this as we all are. And I know we're all home doing projects, et cetera, but we've got to have patience with these folks as well. So the same thing we talked about earlier with the grocery stores, of just remember the kindness. And again, I know this sounds a little preachy, but this is very stressful for everybody. And for the businesses that are open and for closed, not their fault. Let's all work with each other as best we can.
Agreed. Thanks, Sean.
Sarah, I appreciate you keeping us abreast of everything there. I know there's a lot going on, and unfortunately, I just saw a report the unemployment rate has gone over 20 million for the country, so another 5 million claims last week. So we're all unfortunately in this together, but we're in this together. All right. Have I missed anybody? Is there any topic that sprung to top of mind while I've been droning on here? Got a smile out of Maria on that one. I like these Zoom meetings. I can see whether my humor hits or not. All right, folks. I appreciate everything you do. We'll keep this meeting again for next week. I look forward to the day where we don't have to have this, but I do enjoy speaking with all of you. And I feel very good about as a member of this community that we're in good hands. This town is well prepared as always. Obviously, there are challenges popping up. It is stressful. It is a hard time for folks, but I'm once again very proud of our team and remember how lucky we are to have all of you at the helm of our ship here, keeping us going. So thank you all. Please stay safe. Take care of your families, and I will talk to you all soon. We are adjourned.